Hi, good evening. Thank you for joining me tonight. My name is Christy Martin, and I'm with the Champaign County Regional Planning Commission Early Childhood Education Program. And we have invited you here tonight to talk with us about the COVID vaccine and kind of some of the fears and concerns that our community members and our staff have expressed with us. So I want to get going tonight by just first introducing our panel members and learning a little bit about you. So Chandra Somerville, she is the Cultural and Linguistic Competence Coordinator at Champaign County Mental Health and Developmental Disabilities Program. Chandra.
Hi, good evening. Thank you very much for inviting me. As a lifelong resident of this community, I believe that conversations where we are talking about vaccination, particularly living through a pandemic, is really important to actually have in community with multiple voices, array of opinions, and then also being able to address and raise awareness about what's factual, and also understanding that there are cultural implications and we should be aware and be responsive to the cultural beliefs and needs as well. Thank you.
Thank you, Chandra. Karen Sims, she's the founding director of Trauma and Resilience Initiative, Inc.
Hi, so thank you so much for this opportunity. And I would just want to echo Chandra. I think having conversations about COVID, the social and emotional and mental health implications, but also sort of the what and the whys that might impact people's ability to sort of be open to thinking about it, the concerns that are connected to both individual and collective and historical traumas are all, I think, really, really great that you're opening up this venue. And when I looked at the list of questions that people had, it resonated that people's, again, personal, cultural, family stories and fears were guiding some of those. So thank you. I look forward to being here.
Thank you, Karen. Yolanda Hunter, she's the project director of Youth and Family Peer Support Alliance.
Hello all, thanks for the invite. I agree with everybody else, what Karen and Chandra said, and basically I think that it's very important that I work with families to make sure that when in any type of situation, family voice is being brought to the table and families are being heard and they're able to articulate how they feel about whatever the situation is, COVID, mental health, so forth and so on.
Yeah, absolutely. Thank you. Mm-hmm. Then we have Reverend Terrance Thomas from Champaign's Bethel AME Church.
Good evening, everyone. It is a pleasure to be here. While my official role tonight is pastor of Bethel, I serve as a hospital chaplain and have been one for the past 6 years. And so I thought this conversation was critical in terms of the impact the pandemic has had on people of color, our communities, and to dispel some myths about the vaccinations and other things that's happening. We, as the other panelists have indicated, we need to have a holistic conversation so we can move out of this thing. We will move out of this thing, but how we do it is as critical as it's been to sustain it.
Thank you, Reverend. Audra Owens is a licensed Illinois early childhood teacher and educator.
Hello.
Hi.
This is the first time, like I said, I've ever been on or in a situation like this. Dealing with the pandemic has always been forefront for me because as a child, I had to go through the vaccinations of the polio vaccine. And here I am 60 plus years later, and now I'm dealing with another one. I figured that I needed to have some kind of input in this conversation because usually the first people that our families see are the teachers that of the people who are receiving their children. So I wanted to be able to relay some information back to them. I have my own opinions, but I think I need informed opinions. Thank you.
Thank you, Audra. And then we have Stacia Simmons with CU PhD.
Hello, everyone. Like my name is Christy Simmons. I'm representing the Champaign-Urbana Health District. Just a little information about me. I was born and raised in Champaign. I'm a recent graduate from the University of Illinois, or their Master's of Public Health program, and I currently work as a COVID lead investigator. As everyone said, I think that this conversation is very relevant, and what's going on with this pandemic. How the African American community is being hit so hard. I think it's very important to have this conversation. There's so much information that's flowing. I think, like I said, it's great to hear different perspectives and also, do what we can coming together to get this pandemic under control. Thank you so much for having me.
Thank you. And then we also have Dr. Henry Moore. He is the Associate Medical Director of General Surgery and Urology at Carle Foundation Hospital.
Hi. I've been at Carle for about 12 years, working here. I do trauma, I do critical care, and emergency general surgery. I work in the ICU, and I've taken care, sadly, a lot of COVID patients, and I've seen a lot of them die, unfortunately. And so anything that we can do to get people vaccinated, I think is going to be a good thing.
Thank you. Thank you, Doctor. So currently our county is in phase 1B, which allows for childcare workers now to receive the vaccine. So I'd like to start with discussing just in general, how safe is this vaccine, and what should people look out for when they get it?
I'm not an expert on the vaccine. I get the same data that sort of given out via the Washington Post and that sort of thing. But I did read through the Pfizer and the Moderna vaccine. Both of them are, they're not live viruses, and so you're not going to catch a COVID infection from these viruses. They actually take a piece of the virus and that codes for this protein that's on the outside of the cell of the virus itself, and cause your body to have an immune reaction to that. So I don't want people to think that we're going to be giving, the symptoms that they have are basically their body's immune response to the vaccine, and not giving someone the virus. Like there are vaccines where you get live, basically live weakened virus, or you get dead virus, and you can get it, but you can't get it from these. But they are very safe, and the side effects generally, as long as you don't have an allergic reaction to what's in them, and I can't even pronounce what half the stuff that's in these things are, because they're these long chemical names. So it's pretty rare for people to have immune reactions. But if you have, in general, sort of a hyperactive immune system, you're more likely to have an immune reaction. Those are the people that we really have to worry about. But for the vast majority of the rest of the folks, it's very safe. We don't have any data. We don't have a lot of data on, the virus has only been around for a year. So we don't have a lot of data, period. The data we do have is generally going to be on healthy people, and not necessarily, the concerning populations, which really are, pregnant people, and how do kids react to it. And so the recommendations are the current vaccines are for adults. And then we're telling people, I know the latest I saw about pregnancy, sort of it's up to the mom, whether or not she should get it. It kind of depends on how healthy she is, and how well she's able to quarantine herself away from, other people. So.
And is there any word on when or how soon the children under 16 will be eligible for the vaccine?
I know, the last I heard from Dr. Fauci, who I'm listening to just like everybody else, is that they are working on a version for kids, but nobody wants to give their kids something that hasn't been tried on in kids, and so they're currently enrolling kids in trials to do so. So it'll be probably at least 4 or 5 months. He was hoping by the time kids are out for the summer that it'll be approved, but there's no guarantee.
If I could, I was just talking to a colleague of mine, and we're looking at the CDC, and I know Moderna is currently studying a group of 12 to 18 And just to add a little statistical data in there, these vaccines are known to be 95% effective.
Okay, very good.
And can I just add one more thing, Christy? Right, so this is part of the transparency that I think, like, because I should be completely clear, I'm not like an anti-vaxxer. However, I think, right, people's fears. It didn't just get created this year. I think that that's a big fear. So I think we should like over communicate to people and not under communicate so that people trust, because a lot of people think like, how did we come up with a vaccine this quickly when we don't have a cure for the cold? That's some of the things that I hear, right?
Yeah.
And it's because research around the cold, research around other viruses, research, like, so I think people don't understand, like sometimes you build upon research. And so from my awareness that this has been 20 years in the making, it wasn't just like presto magic, we figured it out in a year. So part it, because it has some of the same makeup as other things, part one. Part two around honesty is there's still a whole bunch that we don't know, right? And that's with any new disease, that right? COVID is a novel disease. The cures are novel. And so we all, like, in some ways, right, like take leaps of faith. So there's science stuff that we trust. So trust science. And there's data that says that. And then there's also going to be so much that we don't know. And I think the more honest we are, like in our brains, to say, you know, we may not know it, but how much faith and trust around science and the medical system can I gather? How can I be as informed as possible? The easier, but I don't want anybody to feel like somebody guaranteed them something, because I feel like then that's how we start to distrust the system. So really just to sort of be open to the process. I mean, people joke, okay, this is a inside joke, right? But we always joke, right, that people are practicing medicine. And right, there is a little bit of that. Like there's no exact science. Human beings are complex. Our bodies are different. How many different high blood pressure medicines are there? It's not like it's just one like easy like box that we all fit into. And so know that we're going to learn a lot and be open to that journey. So I think that that's just a brain thing.
Yeah, and
Can I?
some historical data, just really quickly on the whole sort of virus thing. So fortunately for us, the coronavirus doesn't mutate very quickly. We've only identified, I think, 4. There's the South African variant, there's a UK variant, and there's like one other one I'm blanking on. So Brazil. It doesn't mutate like the flu or like most other viruses, but we've been dealing with coronavirus. Most coronaviruses cause cold-like symptoms. This is a novel coronavirus. This is the second one. The first one that we encountered was back in 2002 when it was a big SARS epidemic. Those of you who are old enough can remember that we're like, oh my God, we don't want to get that stuff because it was overseas, and we were hoping it stayed away. Unfortunately, we were able to contain it. And then I think about 4 or 5 years later, there was a Middle Eastern version, and both of those had lethality somewhere in the 10 to 15% range. The lethality of this coronavirus is less than 1%, somewhere about 0.5%, which is actually greater than the flu, but still pretty lethal, particularly in patients who are, honestly, a lot of the data is showing that people who are diabetic seem to have much worse outcomes compared. And unfortunately, diabetes really affects the population that I am part of, African Americans as well as Latinos. And so those people are certainly at higher risk. And normally it takes about 10 years to roll out a vaccine. The reason why that we were able to roll one out in basically a year is because these two processes these vaccines that we have now it's a novel process that has been used before to speed up the production of the vaccine. But honestly, I think the virus itself had been, like, the genetic code had been found in like a month or two. And so there's a lot of things that we can do a lot faster, but it doesn't mutate quickly, which allows us to have a vaccine that hopefully is going to be effective. The other thing I would like to add is that, these are 93 and 95% effective. So technically you can get the vaccine and still get infected. Not everybody, it's not 100%, very little that we do is 100%. And so you can still get infected, which is why we're telling people who get the vaccine, wear your mask, wash your hands, social distance.
Audra, were you gonna say something?
Oh, I just wanted to know, I mean, we're always addressing, the typical maladies that we have as people of color, like diabetes and uh, obesity and things like that. But what about people who don't have the typical, uh, well, Black diseases, the underlying conditions? Are we still waiting for them to be able to take it, or can they take it now?
I think the general recommendation at this point is for people who are immunocompromised. So people who are taking steroids, people who have autoimmune disorders, anyone who has a sort of a medical condition, you're sort of at higher priority because your body is compromised. It's why we haven't rolled it out to healthy 20-year-olds yet, because we want people who are most acceptable to having bad outcomes to get it first.
Yeah, and also individuals who have high risk occupations as well, that have that one-on-one contact with individuals. We are prioritizing them, and like I said, our elderly population as well.
Yeah, so locally, right? So because right, every state's different or every county's different, but locally right now we're doing essential like workers like who work schools, Dollar General, factories or whatever. The next group of people in the list, because I pay attention, I actually act like I'm like a ticket, say it like scalping tickets. I hit the refresh button several times a day. But the next group are people 16 to 64 who have underlying conditions will be the next group of people in the lineup. And this is a geeky, nerdy thing. So again, sorry about this, but if you have autoimmune disorders, they actually just released a study today that said that there were no additional risk factors if you have, lupus, RA, gout, all of those things. It actually, the medicines that you take that are immune suppressive didn't impact your outcomes. And so you can go, so it's highly recommended that you get the vaccine and that you should have fairly good outcomes. So
So how can our systems of care use trauma-informed principles to increase the trust that we know is needed?
I think Karen touched on that at the beginning. I think naming it. The healthcare system has not been, in the United States, has not been kind to Black folks and other people of color. There's a litany of this. There's other pandemics, from AIDS to Tuskegee, who we can call the role in which has been mishandled. We can look at our current healthcare discrepancies and deficiencies. And so I think if you want to earn trust, at least how I understand it, is by owning, hey, listen, we failed in these categories. We failed consistently even to this day. We don't know, we keep every other week, we fighting over Obamacare. And so I think owning that on the front end. What you don't want to do is lie to people and act like this is the most perfect healthcare system in the world. There are no problems. When I'm watching my grandmother struggle with care, when I'm watching the people I love struggle. And so naming a thing is critical in trauma work, addressing the violation, as we call it in spiritual care, so we can move forward. We can start healing. We can say, hey, I know that happened. That's real. Let's process it. And is this sort of the same thing that's going on? So a lot of people, Karen brought up, invoke Tuskegee. And I've had people say that in my congregation. You work at that hospital, ain't this like Tuskegee? Tuskegee was horrible, should not have been done. All those people should have been purged from humanity. However, Tuskegee was the withholding of care, not the giving of care. And so therein lies the difference. And so when you talk about it like that, and when you frame it, it tends to, okay, I hear you, I hear you, I hear you.
And also you have to acknowledge, I mean, you bring up Tuskegee, but also too in this present day, a lot of the malpractice that is going on, like if you've heard the story about Dr. Susan Moore, who was a doctor that was under the care, it was a hospital in Indiana, and she had documented it on a live video of her mistreatment there, and she ended up passing away. And then I was reading the article and I was like, nobody's acknowledging, right? the malpractice or what went wrong. It's just like, you know, oh, we uphold these certain protocols. You know, we understand, you know, we see that there's protocols in place, but we're not acknowledging the situation at hand, right? And I think there's a lot of that going on where a lot of that is swept under the rug, right? Instead of addressed, right, and acknowledged. And so I think that contributes to the distrust. You know, like I said, we could talk about Tuskegee, but we need to talk about a lot of the things that are happening right in this present day.
So how would you recommend folks advocate for this change, for these systemic changes?
You want? Oh, okay. I
Yeah,
mean,
yeah.
Oh, was somebody going to say something?
No, please.
Okay. Like I said, I think, you know, people, they need to speak up, right, about it. Even, you know, in the medical staff, you see a lot more people now that are being more vocal about some of the things that they're seeing in these situations. I see even that, you know, the Surgeon General, he uses his social media page and platform to bring about some of the issues that he's seeing, and like how the vaccinations, like the demographic data, it's not being posted. You know, I think just being vocal in that way and using, you know, your platform, right, as a way to speak out, you know, about these issues and have these conversations is a way.
Another thing is also being able to honor and recognize health history and family history. I don't think that we do a good job of passing down health information with our stories. We leave parts out. And so I definitely believe learning about your health history from where you've come from, passing that along, I think is also a piece that can be important to also begin to destigmatize the conversation about our health. I think about, I'm in a caregiving situation right now, and a lot of questions that I'm asking have not been asked before previously. So it's being okay with asking questions. And Karen calls it the nerdy type thing, but what she is actually doing is she is being informed about what she's taking, what implications that people are taking, just a different medication, not just because even though she's not in the medical profession, she's making sure that she is educated about it and getting understanding about it. And so I think that will also decrease stigma as well when you're willing to, again, tell those stories that pass down health history from your family members, making sure that you keep that conversation going. And when you are afraid, getting like people like a chaplain, people who are advocates in the community, having doctors like Dr. Moore, who is actually understanding like quality patient care and saying, hey, ask me questions. So encouraging his colleagues to be open to people asking questions that they just may not be clear about as well.
So can I thank you. I have just a couple other things. One, I want to say, because we didn't mention this, there is not truth, right? Like falsehoods that say that there is a separate Black vaccine. I don't know if you guys know, like there's a whole bunch of mythology out there about vaccines. So there's a myth that there's a special, like that there's the vaccines that have been approved for white people and that Black people are going to be offered some vaccine, right? Like just getting some clarity about the mythology, being curious about, so like when somebody sends me a news source, double checking the media, like who's sending it. And you can pretty much like check the news source pretty quickly and always wonder like, whose interest would it serve for me not to be vaccinated or to be informed or to have all of those mythologies. So part one, Shandra hinted at this, but I think we gotta be, and Pastor Thomas mentioned this too, just a whole bunch more transparent about information. And so when patients come in or are curious about things, doctors got to just sort of wait it out and talk it through, and you know, and be open to sharing, to not do the rosy picture, right? Like to say that there is complexity with everything. So, and also to be aware, we didn't talk about this, but there's a lot of mixed messaging. So on one end, we say it's super serious, and there's lots of messaging around take care and be careful. And then we have like codes and policy, and we open up restaurants and bars, and then it's mask optional, mask, right? Like it's a whole bunch of mixed messaging that for our brains get really confusing. And so I think we need to also be honest about that too, because that says something around how serious we're taking this issue as a community, as a people, right? Even understanding like vaccines are about you, but it's also about the other people around you. So even how we narrate things make a difference. Like mask wearing is a lot about the people in your lives. And then last but not least, and this is more for like people who are working with, know that people of color are not one monolithic group. And so there is a lot of variety in us. I'm part of a family like discussion, and we talk about COVID like literally almost every Sunday. And there are as many different opinions in our family about COVID, about its etiology, about the solutions. And so if you say like, I mean, because I hear on TV, what we need to do is have like credible messengers deliver the message. Well, in my family of 22, who would be the credible messenger is as varied as it would be for any other community. So, because a lot of times people are like, well, just haul out another Black person. And as long as there are Black people who other Black people know, it'll be like, woo, great. And so I think we have to be culturally responsive in our approach and to realize there is a lot of variety. Just because there are skin color connections, our family narratives about prevention and wellness and are very, very varied. And so, right, our faith traditions guide that. So you guys got to get to know us in order to message to us.
So being impacted by systemic racism has been identified as a risk factor for health outcomes. And of course, COVID has really amplified this issue. So what types of systemic solutions should we as a community be considering to address health equity?
From my point of view, if I say that I feel bad, if I have these symptoms, don't automatically assume, and I have run into this at various hospitals, don't automatically assume that I'm some druggie trying to just get a fix. I know my body probably a lot better than the people who are taking care of me. Try to address the fact that these are my concerns, and this is what you need to do for me. Eliminate it. Don't compound it.
You know, just thinking about this, we have recently formed a group of Black physicians at Carle. We've gotten together to try to improve things sort of on the inside, because there's sort of, you know, in my mind, there's sort of the in-hospital things amongst us as physicians and staff, how the organization works, but there's also things like, you know, why are, you know, perinatal deaths higher in African Americans, you know, and, you know, how, you know, what are our local numbers? How can we improve our local numbers? You know, when it comes to things at Carle Hospital, because I you know, just recently we're trying to get some of this data. How are African American, how are our outcomes at Carle compared to some of the Caucasians? And so we're starting to try to see how, you know, if there are inequities and how we can fix those in the hospital. There's also sort of the community health issues where, you know, it's both, you know, underserved populations. How can we better serve them where they are? Because a lot of people have issues coming to the hospital, getting treated. There is this overall mistrust of the medical system. So how can we engage these populations to try to get them where they need to be? And and where they need to be. And so it's a multifaceted approach, and it's almost at every level of healthcare. We need to look at what we're doing and see how can we improve it.
I think in terms of, there's two approaches to this. Of course, there's the macro, fighting for universal health care. That's a dirty word. It's not socialist. It's universal health care, not Obamacare. It's the watered down version of universal health care, but universal health care. I think for hospitals, which are employed by one, training people to treat people like decent human beings when they come through the door. So before we start talking there, do you treat patients differently because they have insurance? Do you treat patients differently based off of the type of insurance? I experienced that today as a pastor. I don't have Blue Cross Blue Shield. I got this off-brand insurance I have to give. And the minute I pulled out my card, now I'm in America's Best, right? She got stank. I can still pay for it. It wasn't an issue, but she got stank. So I said to myself, if I'm middle class comfortably, if I didn't treat it like this in this context, based off of the insurance card, my God, if I'm a single mother of 3 coming in from the cold after work, after a hard day, and I don't have insurance, how are we acting? I think healthcare, how we use security protocols. A couple of hospitals in the area, I don't know, the security act like law enforcement do on the streets, right? So I think there's a very humanizing thing that we need to do and be intentional about training folks, right? So if you know your clerk in the ER is nasty, then she don't need to be the clerk in the ER. If you know you got a nurse that don't know how to treat family decent, she don't need to be a nurse in the ER. And so before we start tackling systemic, we need to hold these institutions in our community accountable for the ways in which, because before we start talking about halls of Congress, that's our front line. That's our front line. So as much as I honor Dr. Moore, glad to have virtually met the brother, there are doctors that do what Sister Owens said, like discount and don't treat like human. And so we gotta address that. We gotta address the classisms and the other isms that's present on the ground in healthcare. And while we are at the same time tackling the social and the societal and balancing out of everything.
I just want to add that everything does go back to trust and transparency. And I think that if we want to break down system barriers around, I guess we talking about Black people or poor people, health concerns. So you want to start off with a whole transformation of the public health systems. You also want to incorporate more comprehensive research opportunities, and you want to do some more interventions and some preventions and some early interventions, because right now people are only going to the doctor when it's acute. And that's an issue, because now it's too far long gone to even probably do anything about it. And I know personally for myself, just going to the doctor is a hassle. It's a hassle getting an appointment. It's a hassle even finding a doctor that could even relate to you. It's also a hassle when you're in there conversating with the doctor and you're trying to explain to the doctor what you're feeling, like Ms. Owens said, what you're feeling, your symptoms. Because at the end of the day, when I talk with my families or my peers, people that I support, and I tell them, when you go into the doctor diagnose you based off of what you tell them. So you need to be very clear, understand your health. Don't be afraid to ask for things that you want to ask for. And we have to have candid conversations, not only with our family members, but with people that we work with. If you're working with families and you want to have candid conversations about when you go to a doctor's appointment, what do you do? What do you ask? If you're afraid to ask and you're not sure, or you caught up in the middle because they come in and out, write everything down and make sure you have them sitting there waiting for you to get finished and get through all your questions. And then we don't want to blame everything on the health system, because we as Black people, we have our own little theories and our own little hang-ups about the doctors. And we always want to go back to Tuskegee Institute, but we always want to pray about stuff. And I'm a firm believer in prayer. I'm an avid Christian, but at the end of the day, you need to go to the doctor. You need to go to the doctor. Insurance needs to be more affordable. I don't even like going to the doctor. And I'm a professional and I have insurance and I'm supposed to have good insurance, but the copays are high. I don't want to do that. I'm like, no, it's not worth it. My mom is 60, 66 or something like that. She don't like going to the doctor. I have to go to the doctor with her because if I don't, it's going to be combative because she's not going to want to hear anything they say. She's going to shut things down. She's not going to be totally honest about things. And so I have to go with her. So when it was time for her to get a COVID shot, Mom, you want to get a COVID shot? She looked at me like, do you think I really want a COVID shot? I'm not doing that. She was like, you must be crazy. And I'm like, I'm not crazy because I was hoping she'd go get a COVID shot because I take care of her that I might get a COVID shot too because I want a COVID shot. But my children don't want to take the COVID shots. They're young adults. They like, So the reality of it is, it goes back to they don't trust the system. They're not sure, like Karen said, that these make-believe stereotypes or these things that people are saying about the shot. They got some for Black people, some for white people, and we have to have open and candid conversations about what it's really about. Like, what is COVID really about? Yes, I know you feel emotionally concerned about what's going on. I know that you're afraid. Have those conversations because this is a scary time. It's unpredictable for everybody across the board. This doesn't just, it affects Black people more because we have a lot of distrust for the system. And of course, healthcare is a system. So.
Can I add one more thing? Thank you. Because your question was around structural inequities. What do we do? And I think, right, it's not Karen, right? A lot of the research has said that COVID has unveiled all of the structural problems, right? So everything from people don't have suitable, good, stable housing. So like, it's one thing to say like quarantine, but if it's 5 people in a 1-bedroom place, like, tell me for real, what does that look like? And what happens when the person who's the primary cooker gets sick and has to maintain, so there's some housing issues, there's some lack of community support, there's some financial vulnerability that, we talked about full insurance, but we also should have been taking care of, this is a Karen, this is not Karen, it's Try, but everybody should have been, like the rest of the world, been given funds so that they could stay home and take care of, so we could have quelled the virus down small enough and we could have provided financial assistance to people so that they could do what they needed to do. But instead, people of color have been disproportionately impacted because they don't have jobs where they get a chance to work from home or whatever. Or this is the other like bait and switch around COVID. People have said, hey, you can go get a vaccine if you can come to work. Well, if I already feel like I'm at higher risk, and so, right, people of color are more reticent about COVID and have more risk factors, but then you say the only way that I can go back to work, get the vaccine, is to go to work, but I'm already fearful and I hear this news that the virus is still going, then that seems like a setup. It feels like, oh, once again, the system, right? So we've got system distrust. We also have economic insecurities. We have implicit biases and racism and a lack of cultural understanding. And so you ask, like, where would we start, right? And Pastor Thomas said, we've got to start about the micro and the macro and the micro. But I believe, like, fully, like, we've got to, think about economic support for people for real. Like, this is really like highlighted how inequitable our systems are. And then on the interpersonal level, I think we really need to be invested in what does it mean to be in community with each other. And we've done so much othering, right? Like, those people don't count. Those aren't my neighbors. Those aren't whatever. And COVID has said, for me, it's highlighted how interconnected all of our realities are. And everything that you do in your personal life impacts me. And we have stopped having those conversations. Again, we live in these neighborhoods where people don't speak to each other and don't talk. And COVID said, if you do not see our interconnectedness, I will do things that hurt you and make you unable to live your life, and you will do things to hurt me. And so I just want us to be a lot more human. So that's the micro piece. And then I want us to deal with the economic issues for real. Like there are some structural pieces that have been unfair for a very long time, right? 70% of people who've lost jobs under COVID are women. That's an economic justice issue we need to fix, right?
And to
Even how we craft the narrative, I do struggle when I hear COVID unveiled these systemic. No, we knew they were there. We Americans don't tell the truth. We knew they were there. COVID made it was such that we could no longer lie about it, right? So when the south side of Chicago, their ERs and ICUs filled up overnight, and we had to step back and say, well, we just closed 3 hospitals on the south side, right? When we start talking down here, we got to talk about people underemployed. So COVID, people knew about these systemic inequities. That's why you have the have and have nots. That's why you have Republicans in Congress fighting to keep others down. We knew about it. COVID made it to a point that we can no longer lie about it. COVID forced everybody to tell the unmitigated truth. And that's what made the last administration so absurd, because we're watching people die. I'm walking through the hospital watching people die. I'm sure Dr. Moore see that. We're walking through the hospitals watching people die. And folks like, nah, it's just a small thing. We just, give it a week. And we're like, nah, man, it's not a week. And then we're watching our people die because they don't have access to health care, et cetera, on top of the stuff that Ulanda raised, right? And I think that's what goes back to it starts with telling the truth, because her mother, her family are afraid of a system that has been dishonest, that's misdiagnosed, that's overdrugged, that's experimented on Black bodies, brown bodies, women bodies. And so now we're at a point where we need trust and understanding, this human thing that Karen talks about. And folks like, I got this long list of lies. And so it has to start with the confession. And in my context is in Christian context, it starts with confession and repentance, and then restoration and reparations. And so there's a process to this that we don't get away from, even in the natural.
And if
I wanted to add that, and this is just because I, speak from personal, from a personal stance. And the thing is that, you have, we were talking earlier about who will represent people, because they said we need to have more people. And so this kind of burns my patootie that you have people of, fluent Black people who have money, like Gail, who's afraid to go to her daughter's wedding because of COVID, right? Because we know that you're safely distanced. We know that you have, the access to be safe and healthcare options. And then us, the regular people who's watching this, start to think that, oh, in order for me to be safe, I can't be around my family. I can't be around my cousins. I can't do this and I can't do that. And then this virus is separating people. So it's pulling people apart, and people are not being able to connect, because as a human being, especially in our culture, we like to socialize, we like to do things with families. And so that puts even more emotional stress, because now we start to think divisively, like, oh, okay, maybe they're trying to keep us apart. It's always an angle when Black people see things. And so I want to say regular people who are not as fluent need to have these conversations in their communities about, like we having now, like right now we having this conversation. How many people in my neighborhood is going to be able to hear this? And is it going to be relatable enough for them to say, I get it. I believe the information that they're giving me. And so therefore, I'm gonna go with that, because oftentimes we can't even relate with our own people for them to even trust us to say, let's take this COVID shot, or let's practice more ways to be safe, and let's be creative around how we engage with our family and our friends.
That sounds like we're evolving around to the educational factor of how are we going to relate to people about the truths that's out there about COVID and Black people. Right now, this was a question for me when I was sat in on another meeting. How are we going to, considering that as pre-K, we are the first people that these children and usually Black, Brown, and Indigenous, these young people see. We are the first ones that they see. How do we communicate how to stay safe to them so that we can actually get this information out to their parents? Because you got to admit, we're Zooming now, but not everybody in communities that look like us have the ability to Zoom. So what else could we do? I talk individually to parents who are comfortable enough to talk to me, because I do have parents who will talk to my coworker because she doesn't look like me. So how can we make these parents comfortable enough to receive this protective information that we are trying to give them? Look at everyone's faces. We're puzzled. We're puzzled.
Actually, I have a couple thoughts. One, each one reach one, each one teach one. So I started my career off in HIV and AIDS. So as you learn, make a commitment to tell 5 friends. The other thing is to work with your parents, right? Yolanda would tell you. The next step would be to have 4 or 5 parents who get it, that are on board with you, help you find ways of educating 4 or 5 more parents, right? So when we were talking HIV and AIDS, we had Tupperware parties, and you could do Verge, you could do texting. They do, even people who don't do Zoom, do Clubhouse, do a whole bunch of technical, they do Facebook meetings, they do a whole bunch of technical stuff and find out where they are. But right, if I'm working with the families to say, okay, I'm gonna make sure you have the right facts, and I'm gonna keep you informed with the right facts. And then I am going to help you, and we're gonna work to co-create ways that we get messages to you. And then we're gonna keep doing that. And with like everything else. So we know a lot about how behavior works and how to do behavior change. And also public health. Like this isn't like novel rocket science. So I will say, we know like talking to people makes a difference. We know that people need to hear a message about 10 times, right? We also know that what common sense ain't common. So like, don't make the message stupid. Like sometimes you got to figure out where people's heart buttons are. A lot of times we give messages out that aren't related to people's heart buttons and they're stupid. Like for example, when we used to tell people to use a condom, that was a dumb message because it wasn't about why people have sex. If I want you to do safer sex, I got to figure out what's in it for you and then backward engineer, right? Like, does that make sense? And so we know how to do this. Like, if we're in a university town, there's a lot of expertise. So use the experts to help and then partner with the community to do it. But my fear is what I've seen is we keep doing stupid stuff over again. Because I swear every day on the news, I listen to some doctor say the same thing over again. And I was like, you have not talked to anybody in the community, but you guys have the 5 talking points that you say over and over again. And I know a whole bunch of Black people who are thinking bull crap. And so they're not applying years of research in public health with their messaging. They just keep doing the same thing over again. And I wish we would stop that. So I think that there's a lot, I guess that's my short answer. So Stacia, right, like you've lots of information out there about how to do this. Let's just do best practice.
Right, yeah, for sure. I definitely agree. And then you're working with kids too. It's fun and interactive, right? I've learned, because before I was a COVID investigator, I worked at Next Generation preschool. And so we would sing songs with the kids, interactive activities with them, right? We'd send little messages home to the parents about like just little fun facts, just to get that conversation going, just to get, make it fun and interesting and get the parents involved as well. Like she said, there's so many different campaigns we can do, but you got to make sure that everybody's on board, that we're communicating, that we're being transparent, that we're, really hitting the message home. I know that CUPHD, there we hear a lot of different things. I mean, we, like you see us in the media, we have so many different things going on, so many, questions about the vaccine and everything. And I think it's just important too, even from a health educator, an educator standpoint,
really, like you said, the families are interacting with you. It's a great way to start that conversation, right? In that this is now 1B, educators are now able to get the vaccine, right? Just in small talk, hey, you know, did you hear about the vaccine clinics that are going on? Or did you hear the press release that, you know, the health department just came out with? You know, so many different ways that we can bring it up, right? And then too, I wanted to say something earlier that I deal with a lot in my investigations. I primarily work with employers and outbreaks. And a lot of what I hear as far as the feedback is there's not a lot of, or it's not made aware to them, the policies put in place to help them during, you know, isolation, quarantine. We're calling people and saying, hey, you have to isolate, you have to quarantine. People aren't aware. They're like, I have to work, right? I need childcare. I need all of these different things, right? And then we go and talk to their employer, and you know, the employer is like, okay, we have these policies set in place, but is your employees aware of the, you know, the resources there that helps them, right, during their quarantine, whether that's getting paid during isolation, during quarantine, right? And really hitting home that message, right? Us all working together. And I think that's a big message that we want to hit home at, you know, CUPHD when we're talking to these big corporations, right? You have to have policies in place where your employees feel comfortable communicating, like, oh, I'm not feeling well today, right? I need to go get tested, or, you know, there's so many different things, you know, that we see, you know, even from, you know, others. As far as the, you know, the vaccine, you know, we have been dealing with a lot of, you know, entitlement and attitudes, right, concerning around the vaccine, that, oh, well, I'm this, so I should be, you know, getting this because of that. And it's just like, okay, well, we have, you know, educators or people that are frontline workers that need to be vaccinated as well. But, you know, going back to, you know, what you said about, you know, the messaging and, you know, hitting home, you know, and being creative, right? Whether that's social media, whether that's spreading it to a neighbor, right? Spreading it to those parents, even getting the kids involved, right? You know, let's get the message out there as far as we can, right?
Another thing I would like to also make sure that we highlight, and this is a great example, is seeing community beyond our neighborhoods or our spheres of influence. I think that thinking about the University of Illinois, seeing them not as a part of our community, they are a member of our community. And when they don't value members outside of the University of Illinois, I believe that there is a barrier. And so they can also learn some lessons about seeing the value of community, and also understand and realize that basic needs are basic for every single person, regardless of where you live, what you believe, what you think. Food, water, shelter, and the ability to be able to provide for your family. It's not unique in different communities. That is a universal truth. And not just only looking at one way, just as Stacia and Karen both said, we have this belief that people only receive a message this way from this particular cultural group, or there's only one way to communicate a message, or they're not going to listen to you. Building trust, building rapport extends beyond just someone who can tell you what to do. There are definitely trusted individuals, and I believe there is a term, cultural leaders and cultural brokers, that know the ins and out. But one of the things they've done is they've gone beyond just areas that they live. They are integrated in that entire community. And I think that we need to begin thinking about that a little bit more broader than just only a specific neighborhood. There definitely should be targeted messaging. I'm not saying that that's not happening, but I also believe that it should just expand to be a bit more broader, to be able to reach more people.
Thank you, Shandra. And I also wanted to build a little bit, Stacia touched on this just a little bit, but if you would just expand on how local employers could support their employees in a trauma-informed way around the vaccine.
So like the policies, starting with the policies they have in place, right? And making sure that they are in constant communication with, first of all, we try to foster that relationship between the health department and the employer, right? Just to make sure everybody's on the same page. But then the employee needs to be, know that, these, aware of these policies, right? And a lot of times when they're talking to us, they're like, hey, well, I can't quarantine because my employer is making me come to work, right? Or they're not directly saying that, but they're putting pressure on them where they have to come to work, right? And so then we're having to talk to these employers, and there's different grant and funding and things out there that HR is aware of, but they're not telling that to their employees. And so then our employees, then they come to us and they're like, well, what do you want me to do, right? And then it becomes this, this constant battle. So I think that really, what goes back to what that overall theme of, of making yourself aware of what is out there, right? And what is available to you, right? So, because a lot of times, unfortunately, these corporations, if you let them take, if you let them take advantage of you, unfortunately, they will, right? In that knowing that you have a voice in the workplace, right? That you can speak up to these, to your, bosses and supervisors and say, hey, I matter, right? My health matters, right? Understand that, you need me here, but also too, like, I have to be at my best in order to do my best, right? And I think also too, this pandemic exposes a lot of people's attitudes too, right? In a sense of that, some of these employers, right? This is business, right? They don't value their employees. And so when we're talking to them, and they're telling us, what their employers are saying, sometimes their employers won't even want to talk to the, the health department. And, we have to reiterate to them like, hey, it's important that you speak up about what your needs are, right, in your home, right? And they know these HR, they're human. They have the same needs as their, employees does. But I, like I said, going back to really fostering, having their employees have a voice, right? And knowing also as an employee, knowing your rights, right? Knowing the things that are available to you and not being afraid to speak up about those things.
And I want to add to that. I just did a training last week on how to support your staff, how to support staff and why everybody is struggling. And I did tie it in with the considerations and the trauma-informed principles, because the trauma-informed principles will help you guide your staff. And that's another whole story, because people in this community should be trauma-informed, but we know that they're not always fully trauma-informed. But it goes around, to support your regulations and prioritize relationships, explain the why to the employees, help staff know what to expect, and then to reframe the behaviors. And you tie that into, people want to know that they're physically safe in their environment, right? They want to know that they have emotional safety, that they can go to their boss and explain, or there's somebody, I don't know, what do they call it when you can just talk to people, for emotional help? Yeah. So, and build a peer-based relationship, find another peer in the office that you can bond with. And then, I don't know all the principles by heart, but back to my favorite one, trust and transparency, being able to have your employees trust you and know that you're going to give them the best possible and honest information about what's going on. And then the voice and choice, when people know, when they're educated, they feel empowered, and cultural responsibility, taking in mind that your staff is of different cultures. So everybody's going to need something different. And then at last, collaborating with the staff, asking them too, like, what makes you feel safe? What do you need? And so, and Karen's an expert. She's a trauma-informed expert, but just taking those principles and applying them in this situation, because right now, everything is unpredictable and people just can't plan life like this.
And okay, my closing statement on what you just said, Yolanda, thank you very much. Again, I told you that I started out in the first, I don't know, you can't call it a pandemic, but when polio first hit. Okay, we got information then, they talked to us, they told us everything that we needed to do, we did it. But now, everything, all the information that we seem to be getting and we seem to be disseminating sounds like a PSA. I have had 40 years of the same information with new verbiage. What we need is what you just said. We need someone to just sit down, realize that the person that you're talking to might not look like you, but try to understand each other so that we can wind up at least on the same page. I mean, 40 years, right now you guys are saying trauma. I'm sorry, when I was a child, it was the poor black kid, and now it's the traumatized child. So that's just, I mean, this same kid 40 years later with an updated title. We need to just start talking to each other.
So we'll have to have a separate conversation about what we mean by trauma, because it's different than probably what you're conceptualizing. But I will say my closing things, and I think Yolanda, thank you for bringing in why we need trauma-informed systems. But the question that you asked is, what could employers do? I think having a constant feedback mechanism where you're evaluating what's doing. So like, so how you're rolling out messages, how you're explaining things, figuring out like what's missing, because I think not seeing your staff as human and co-creating with them, like engaging in power sharing, means that frequently you develop a policy and the people most adversely impacted by the policy are the ones whose voices didn't get included. And so to really revisit that process over and over again, I will say, like, as systems, a lot of what I've seen roll out as COVID policies really probably need to be reimagined and re-engineered, because they don't take the needs of those who are most marginalized and most needed into consideration. So I think we need to do a lot of reimagining, talking to some different voices when developing a policy. So HR needs to shut itself down and really like co-create with, again, those who are most vulnerable.
I guess, are we really expecting capitalism to do what's right and honorable in the year of our Lord? Like, I appreciate the pie in the sky people. I do. I appreciate all the high-minded. We have to love each other. If capitalism was going to do what it was supposed to do, we wouldn't be in this pandemic right now, brothers and sisters, boys and girls. So the question is, what are we willing to do, since we talked about community, to hold those businesses that don't honor the workers? So if we know Walmart is not honoring its people during COVID, should we still be shopping at Walmart? No. If we know a business is mistreating its people, and again, if we had our heads in the sand prior to COVID, we would have already had these practices. So we've been knowing about worker exploitation. It just didn't start with COVID. Mamas couldn't get maternity leave. People break their whole ankle and couldn't get off work. We can't get a living wage. That's why I really, 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 to a point of obnoxiousness, I know I don't do pie in the sky, high-minded language, because we already knew this stuff. And so like, we're sitting here, and I love each and every one of us, expecting capitalism to suddenly develop a moral ethic and ethos. Capitalism, American capitalism, not British capitalism, not Spanish capitalism, American capitalism, to develop a community ethic and bond in which it suddenly will care about the workers and the mothers. And so, yes, go ahead. I know we have to give you time off. Go ahead, Bob. No, that's not how it works. So the question is, how do the community hold these businesses accountable? That's where our conversation should be. And what ways in which, when capitalism does what capitalism does, can Bethel utilize itself? So do we open our doors and create a community center where children can come? Do we partner with an organization and supply resources? What are the ways in which the people can disrupt power? Because again, even we ain't learned no lessons. We're still expecting those who create the problem to fix the problem. And history has shown from time immemorial that they won't do that. So what I will invite us to do is simply say, how can we as a community step up? All right, so mama can't get off. Walmart ain't ever letting her off. You may not want to boycott. Can you help her with her baby? Right, practical stuff. Listen, brother, he can't get off from Target or FedEx. My son worked through the whole pandemic. What can I do to make his life easier? Right? So I'll wash your clothes. I'll make sure you cook. This is what the Panthers understood. Since we're in Black History Month, a quick Black History lesson. This is what the Panthers understood, called survival pending revolution. Each one teach one. It wasn't just a t-shirt concept. That man behind me, George Jackson, he talked about that. How do we put together and build together in systems of oppression? We're in a pandemic. Every church in Champaign, Urbana, your church should have had something for parents to drop off their kids. should have provided resources, masks, etc. Because, and I'm just talking, we're still expecting American capitalism, the same capitalism that gave us chattel slavery, women making 70 cents to $1, that you gotta lie about your income to get Head Start, basic education. We're expecting this system to suddenly do us right in COVID. And I think we're setting ourselves up for heartbreak and more trauma. And I'm done.
Well, we are almost out of time. I really appreciate that. Thank you. I'd like to just ask one last question. What really do you hope that folks take away from this talk tonight? Shandra, let's start with you.
Again, that when you really pay attention to the least of the people and the most underrepresented and marginalized people, everyone will be able to do well.
Thank you. Stacia?
I really like the point that Pastor Thomas made about, us coming together and working together to help one another, right?
Yeah.
I think, like I said, whether that's spreading the word, or, telling the next person, about the vaccine, and like when people bring you stuff that's not true, right? You saying, hey, this is, I know you heard that, but this is what it is, right? It's going to take a village, right, to get us through this pandemic, right? But I think if we come together and, you use your voice, right? You use your platform in any way, like to spread these messages, right? So that we all can be on the same page, right? So that we can be educated, right? So we can get this pandemic under control.
All right, thank you, everyone. I think that's our time for tonight. I don't want to keep you any longer, but I really appreciate your time and your input. Have a good evening.